Women's Health Connecticut is the largest OBGYN physician practice in the region and solely focused on women.
Average woman with no family history of breast cancer, we have about a 12% lifetime risk, even if we do everything right. Once you get another family member or two with breast cancer, that can increase our risk above 20%. A 20% lifetime risk of breast cancer is considered an increased lifetime risk, or a high risk. And many times things like getting MRIs in addition to mammograms, maybe meeting with a breast specialist, those are appropriate considerations that a woman might choose to opt for, knowing that she has that little bit of a higher risk.
So we all know the importance of a healthy lifestyle, but how does that reduce someone's risk of getting breast cancer?
The modifiable risk factors primarily are lifestyle, which are going to include things like trying to maintain a normal, healthy BMI, trying to get adequate exercise is really quite important. Even if we are always going to be a curvier person, or we're always going to be a little on the slimmer side, trying to make sure we get 2.5 to 3 hours of moderate activity per week, that really is going to drastically reduce our risk for breast cancer, about 40%. So that's huge. Things like stopping smoking entirely or cutting down. If you stop smoking, you're going to reduce your risk by probably at least 10%, if not more. Alcohol is another big kind of lifestyle piece we can look at. Unfortunately, probably any amount of alcohol increases our risk for breast cancer. I think quality of life is part of this discussion. So I don't mean to tell people they're never allowed to have a glass of wine at a birthday party, but trying to kind of keep it to no more than a glass or less a day. If we're looking at 2 to 3 glasses a day, that can increase our risk by like 30% or so.
What do you do to encourage patients to be proactive about their breast health?
We definitely encourage women to have self-breast awareness, and they're of course with their body 365 days a year, whereas their gynecologist or even their mammogram is typically maybe only once a year. So there's an opportunity there to catch things that we wouldn't get on those maybe 2 days of the year. As a breast cancer survivor myself, and though I try to be proactive about making decisions that are going to reduce my future risks and my risk of recurrence, I want to reiterate and acknowledge that as women, we all have some risk, even if it's that average or lower risk, that's still a 12% risk, even if we do everything right. So I don't want people to feel like they did something wrong if they someday are diagnosed with a cancer, or that they didn't do something right. But I think even though there's this risk that exists no matter what we do, we can take the control into our hands of trying to reduce that risk.
Dr. Shipman, we're so grateful that you shared your story with us today. I know it will help so many women at home who are watching, so thank you for your time.
Thank you so much again for having me here today and allowing this platform to speak to so many women about these important issues. Our goal at Women's Health Connecticut is really to reach as many women as we can and help support them by giving them knowledge and empowering them to make the best decisions for themselves and their families, so that they can be safe and choose options that are going to reduce their risks, early detection, come for their annual exams, get that annual screening, and stay safe and healthy.
Women's Health Connecticut provides comprehensive OBGYN care and compassionate support as you navigate through each stage of your life.